Mutant prolactin receptor and formula hyperprolactinemia. Definition: hyperprolactinemia that is not associated with gestation or the preparing is usually due to tumors in the anterior pituitary gland and occurs occasionally in hereditary multiple endocrine neoplasia syndromes. Here we report data from their sister with hyperprolactinemia. 2 of 1 presented with oligomenorrhea and 1 with infertility. The symptoms were not associated with pituitary tumor or multiple endocrine neoplasia, but were due to a heterozygous mutation in the prolactin receptor genes, paired on resulting in amino acid change from histidine to arginine at codon 188.
You will occasionally encounter women with hyperprolactinemia. This segment provides a basic approach to help you know when to order a serum prolactin level and how to interpret and treat abnormally high prolactin levels. Prolactin-secreting microadenomas are the most common tumor of the pituitary, and hyperprolactinemia that results can cause menstrual irregularity, amenorrhea, or galactorrhea, and is a condition you will encounter from time to time. Knowing how to differentiate this from other causes of hyperprolactinemia and what the therapeutic approaches are for these patients is the focus of this Pearlcast. Prolactin is made by lactotrophs, located in the lateral area of the anterior pituitary, as you can see in this drawing. Prolactin is regulated through inhibition from the hypothalamus by dopamine, designated DA, coming from that area, and it is positively regulated by TRH, which is thyrotropin-releasing hormone. Understanding these regulatory relationships will help you remember the causes of hyperprolactinemia. Normal serum prolactin levels range from 5 to 20 nanograms per ml. When would it be appropriate to measure prolactin in one of your patients? Well, the first would be in a woman with irregular menstrual cycles, since prolactin can be a primary cause for amenorrhea or irregular cycles. The second would be women who experience galactorrhea. And in the third case, you might want to measure prolactin in a woman who is experiencing infertility, since prolactin is one of 6 essential laboratory tests for the evaluation of the female partner, along with TSH, FSH, estradiol, DHEAS, and testosterone.
Application in nursing. Informed consent for DNA sequence analysis was obtained for 124 persons, oral consent for 110, unrelated persons, and written consent for 14 persons, 9 family members, and 5 unrelated normal persons, with the use of protocol approved by local and national research ethics committees. DNA samples for the 110 unrelated persons were used as control for assessing the presence of sequencing polymorphisms. A total of 4 of the 5 family members with hyperprolactinemia and all 5 unrelated normal persons also provide written consent for immunologic studies.
As shown in this figure, milk globules can be seen in a microscopic image of the secretions taken from a woman with galactorrhea. What causes elevated prolactin to be present? Prolactin is produced by the lactotrophs in the anterior pituitary, and the most common cause is a prolactin-secreting adenoma. As shown here, the definition of a microadenoma is a tumor that is 10 millimeters or less, while a macroadenoma is greater than 10 millimeters in size. Other pituitary hypothalamic tumors might have a mass effect, as shown here, which is a Rathke's duct cyst. The mechanism for mass effect likely has to do with interference from the hypothalamus to the pituitary, and that, in turn, elevates prolactin level secretion by the lactotrophs. Other important causes of prolactin secretion need to be appreciated as well. One of the most common mistakes is to measure a prolactin level and assume that it is abnormal. A pregnancy test should always be done when a prolactin level is elevated. Certain drugs, including neuroleptics, opiates, or antidepressants, prolactin levels. Prolactin levels might be elevated with no cause identified. PCOS can cause prolactin levels to be elevated. Breast stimulation or breast implants lead to reflex oxytocin stimulation that can lead to prolactin elevations. Hypothyroidism causes hyperprolactin up to 20% of cases due to the elevation of TRH. Uncommon causes would include chronic renal failure or patients requiring dialysis, and trauma or irradiation to the pituitary could be a cause for elevated prolactin as well.
Pros and cons. The absence of abnormal findings of MRE of the pituitary gland in the sister reported here contrast with finding in female preemie means with pituitary hyperplasia past 6 months of age and large tumor by late adulthood. 40 months of age, as compared with male per null mice, which had moderate pituitary enlargement only than 18 to 21 months of age. Then, however, the third sister are only in their 30 seconds or 40 seconds. So it seems plausible that they might have pituitary hyperplasia that is still below the limit of detection of RRE, or that shows abnormalities might develop in later life.
Treatment involves primarily medical management, although surgery still plays a role. For medical management, bromocriptine, which is a dopamine agonist, is used 2.5 milligrams at bedtime. This works to restore menses in 80 to 90% of cases, although a larger dose may be required. A more recent addition to our armamentarium of medical treatments would include cabergoline, which is used at 0.25 to 0.5 milligrams twice a week. Surgery is reserved for cases that don't respond to medical approaches and may be important, especially in cases where there's a mass effect. Observation is okay for women with hyperprolactinemia, especially with microadenomas, along with birth control pills to avoid the hypoestrogenic side effects like bone loss. In pregnancy, where prolactin-lowering drugs may be contraindicated, monitoring the pituitary tumors may be necessary, as these can grow during pregnancy. Baseline visual field assessment might be considered as a good place to start early in pregnancy, since changes due to optic nerve compression can be appreciated if the tumor grows. In hypothyroid-related elevations in prolactin, the prolactin will often return to normal once the hypothyroidism is adequately treated. In cases where psychogenic drugs are the major cause for the elevated prolactin, it should be remembered that treatment with dopamine agonists might interfere with the therapeutic efficacy of these medications. Working with the patient's psychiatrists or other healthcare providers is essential in finding solutions, including the possibility of switching to other medications that do not interfere with prolactin secretion. I hope this has been a helpful review for this topic. Hyperprolactinemia is relatively easy to diagnose and treat if you remember the signs and symptoms. And also remember to check a prolactin level when the need arises.
In swab in Ecuador, family members with normal prolactin levels were homozygous for non-mutant alleles. Weirds affect family members with heterozygous with one non-mutant allele and one mutant allele, which is consistent with an autosomal dominant inheritance for the disease. A mutation carried family member 3, who was 30 years of age and prepubertal at the time of testing, diagnosed hyperprolactinemia, probably owing to an unrelated penetrance for the disease, as observed in the case of the other autosomal dominant disorders, as well as in PRL mice.
The pituitary gland is located just below the brain and contains lactotroph cells that generate prolactin. Prolactin is the hormone that stimulates lactation, breast milk. When you have elevated prolactin levels, then it can interfere with the functioning of testicles in men and the ovaries in women. When the ovaries in women are affected, it can lead to premenopausal symptoms. When this happens, the secretion of estradiol decreases. When men experience high prolactin levels, it interferes with the regular functioning of the testicles and the production of testosterone, an important sex hormone in men, as well as a decrease in sperm. Some natural remedies for high prolactin levels are stress reduction, B vitamins, zinc and magnesium, moderate exercise, avoid alcohol.
Conclusion. In conclusion, we identify a human hair-linked PRLR mutation that affects a loss of function of the prolactin receptor and results in family-insulated hyperprolactinemia, a condition that is associated with oligomenorrhea and infertility. Thank you. A video.
You mentioned that you were recently diagnosed with high prolactin levels, and this condition is known as hyperprolactinemia. There's a lot of different things that can cause it, and one of the first symptoms a woman usually has is she's not having periods or not having regular periods, and it sounds like this is the case with you, as you've been trying to have a third child, and you didn't have a problem with your first two. Many women don't have periods, they go seeking help, and this is sometimes a diagnosis that's found. High prolactin levels affect your ability to ovulate, and that's why it's hard to get pregnant. Certain medications can cause higher prolactin levels, and there are other explanations as well, and it can go along with other hormone imbalances. And you asked some really good questions about how you can balance your hormones and make it possible for you to have another baby. These are all really good questions for your doctor, who knows the most about your situation, your lab results, your past health history, and your current status. I hope the best for you, and if you have any other questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.